How many of you actually knew where your pancreas was before Dr. Biancan showed us that slide? Okay, I think this is a particularly well-educated audience, but the location of the pancreas is one reason that this cancer is so hard to detect, because you don't usually feel anything until it's too late, and when you finally do feel something, it could be anything. I know that when I started to feel sick in the spring of 2008, my doctor thought it was acid reflux or GERD. He gave me one set of pills. When that didn't work, I was tested for H. pylori, which is an ulcer, and that for some reason took a whole month. Can't remember why. There were all kinds of theories. I even had a girlfriend who's a psychiatrist who was telling me it was all in my head. And exactly, she didn't know where it was. My doctor tried to get me an appointment with a specialist. It was the summer. He could not get me in early to see a specialist. I remember I tried calling the secretary to appeal to her. She wasn't very nice on the phone, and she just said to me, "Lady, if you don't like it, go to Emerge." And normally I'd complain about that, but I was feeling so sick that that's what I did. And ultimately, that's where I was diagnosed. I was pretty lucky in the sense that literally 2 days after that, I was in Dr. Gallinger's office. But the time from when I started to feel sick was probably around 3 months, and that's about the amount of time it takes for a lot of patients to get their diagnosis. And given that most people die within the first year, that is really, really time that patients do not have. So the panel you have here are people who are working very hard to change that, and they're being successful. And part of the problem is that most GPs, never see a case of pancreatic cancer from one year to the next. So the McCain Center for Rapid Diagnosis at Princess Margaret is up and running. Dr. Malcolm Moore is the physician-in-chief at Princess Margaret, and he's a leading authority on pancreatic cancer. And Dr. Neesha Dhani is also a medical oncologist in the same unit. And Allyson Nowell is the nurse coordinator of the Rapid Diagnosis Center. And together they have reorganized the workflow to really streamline the process and make it quicker for patients. And they're going to explain that to you.